Let's just jump into what exactly psychopathy is and how you would diagnose it. How would you recognize it? One of the main criteria for evaluating this or assessing this is the psychopathy checklist. And that was created by Robert Hare in the 40s and revised in the 70s. He had 20 characteristics on this, and I'm just going to shoot them out to you so that you can think about whether or not you've seen this or recognize it. And we can't diagnose somebody from afar. We can't diagnose someone if we're not a clinician and they're not in our treatment room. But it gives us some awareness and some insight into this condition and how to think about it. If someone is superficial or glib or charming and has kind of a surface approach to relationships, that might be one thing. Grandiosity is another quality. Seeking glory as well. Deceiving and lying and manipulating. No remorse, no empathy. There's a way in which these people can just move through situations and people's lives and not really take in how what they're doing or how they're treating that person is really affecting them. No sense of responsibility, a kind of a recklessness. Impulsive and spontaneous and exciting in many ways, but there's a dangerousness to it. There's poor behavioral control. And there's something about the future and being able to really integrate the future or conceptualization of the future into the everyday. This person may lack very concrete goals, or even if they have them, not have planning around it or poor planning around it, not really understanding the depth of the situation, what can go wrong. There's an overconfidence in creating plans if plans are created, and assuming that everything is just going to go their way because they're able in their mind and confident and not really capable of failure in their mind. There's also some evidence of what we call antisocial behavior, doing things that are without conscience, not having regard for other human beings or for laws or for rules, and actually not even learning from punishment. And we'll get into that in terms of treatment, but there's a way in which the punishment or the negative feedback is not a deterrent. It doesn't seem to matter that much. There's a need for high stimulation and an intolerance of boredom. Many of us like some quiet time, some relaxation. We don't want the constant input. And boredom for many of us allows for reflection and for contemplation and for a gathering and a reorganizing of our psyche or our day. But they just want to keep going. They need this stimulation. As we said, there was a manipulative quality too. What we call shallow affect. We kind of covered this before with the superficiality. There's also something called a parasitic lifestyle, a way of exploiting other people, melding and merging into what they're doing and taking from them. And there's a kind of perhaps exhilaration that comes from being able to achieve that. Relationships tend to be fleeting or short-term or not deep. There's a kind of a disloyalty. And there may be a promiscuity, a sexual promiscuity, or, another way to think about that is a kind of a duplicitousness, or people don't even really mean that much. Or if they're looking at you and they're very focused on you and very in the present with you and you feel like you're the only person in the world, in 2 seconds they can be doing that with someone else. So it can be deceptive and hard to understand because it feels very real. There's a sense of sort of mimicking a depth when the depth isn't really there. Those are some qualities and ways to think about it. I would say that one of the things that's very difficult for people who are in intimate relationships, whether it's your sister or your parent, you might be married to somebody who has this, it can be very confusing in terms of your inner life, how you respond to them, because there's a way in which you can get very caught up and emotionally seduced, excited, trusting, believing, and maybe there are moments and times when that is actually reasonable. But there's a sort of a betrayal or disloyalty that's operating in a chronic way beneath the surface that can create a disturbance in you if you are tightly connected to someone like this. And you may not be able to identify it. You may not be able to really know why you're feeling badly or a little bit down or a little bit depressed. And There can be sort of overt manifestations of this where someone can be um, mean and cruel in a very direct way, but they can also be passive aggressive, and there can be an insidious kind of trauma to the person, to the loved one. So these are things that we want to think about. It can be profoundly frustrating to be in an intimate relationship with someone like this because you have a sense of ineffectiveness. You have a sense that when you try to communicate or talk about what hasn't worked or what's wrong or what's troubling you, which is sort of the Psych 101 of communication and relationships, it doesn't really work because they're not dealing with reality. They're in this kind of, not actually psychotic, which means not in touch with reality at all. That's not the same thing. But there's a slightly delusional quality, a grandiose quality to them, which makes them have to deny certain experiences in the world for themselves or for other people that would diminish them in their own mind. So it's very important that they have this elevated sense of self. So it's very overlapping with the diagnosis of narcissism in many cases, not all cases. People can be taught to manage their own behavior. And one of the things too that's interesting is that punishment doesn't work so well. It doesn't faze them all that much, but rewards work pretty well. So they get excited about getting what they want, about the reinforcement, about the input. Could be if you're in on a ward or even incarcerated, maybe gifts or, cigarettes or ability to have another phone call. These kinds of things are much more motivating than negative and punitive responses. I would say the main thing that I often tell people is getting over the guilt and getting over the shame and realizing it isn't your fault, because you can get very caught up in self-criticism and, flogging of the self, really developing some self-compassion, some distance. You're a human being on this earth. Your child is a human being on this earth, in the case of children. And you do the best you can to get supports. Supports for yourself are really important, whether it's friends, spiritual advisor, other parents who've been through something like this, professional support in the terms of a counselor or a therapist. But I think for the child or for the person who suffers from this limit setting is actually, maybe that sounds harsh or as if it's taking something away, but limit setting can actually create a much happier life. I like to quote Cicero, I'm not sure if I'm getting it exactly right, but man has laws so that he can be free. It's kind of a basic human need. And we cannot be free if we feel oppressed by what may be coming from this loved one who has aggressive tendencies. And they themselves are sort of victims of their own aggressive tendencies. And that's something else I would like to move into is, what are these self-destructive tendencies? Because they do exist in people who suffer from psychopathy. It's kind of intuitive. I mean, when you think about it, if you're overly confident and you don't have a lot of anxiety, and these are traits that they also possess, and you're pretty grandiose and you feel pretty entitled and you don't do a lot of planning, and you're impulsive and you just sort of throw yourself into things, you may get away with that for a long time because your charm and your excitement and your charisma just wows people and makes them sort of lose their critical thought of what you're doing because you're so blinding in your charm. But eventually, people might make really terrible mistakes financially or interpersonally. There's errors of judgment that are very hard to undo. And so there are ways in which it can become a very self-destructive way to live. And people who have psychopathy can suffer the consequences of their actions in really big ways, because maybe they're going to lose their job, or maybe they're going to end up with a lot of debt, or maybe they're going to lose the respect of other people. And if they're very concerned about image, or which is also falling into the narcissistic spectrum because there's overlap, the sense of humiliation might be very great and very painful. The other thing that could be put into this category of self-destructiveness is there's a sense of not real relationships, which might create a sense of loneliness actually deep down. I mean, you could say maybe they don't care that much about relationships, or those kinds of intimacies don't feed and nurture them. They're not succored for the way they are for many people. But, when you get older, it's harder to pull off these sorts of characteristics. And there's an isolation that may come with having this condition and having made some errors in judgment that led to consequences that were self-punitive.